Welcome to the deep dive. Imagine a world where building healthcare apps, these tools, these systems, it doesn't take years and, frankly, millions of dollars. Instead, they can be spun up really quickly, adapted almost on the fly, constantly improved. That's the promise we're giving into today. We're looking at how healthcare organizations can, well, dramatically speed up building the digital tools they need. We're focusing on something called rapid application development, or RAPID, and specifically how AI is kind of supercharging it for the unique demands of medicine.
It's so critical, isn't it? Because the healthcare landscape, it's just always moving. New treatments, regulations change, patient needs evolve, and traditional software development, it often just can't keep pace. It's slow, it gets complex, and it's incredibly expensive to change once something's built. The material we looked at really stresses this point.
Okay, yeah, let's get into that. Our sources for this deep dive, they really explore how to bridge that gap. They seem to center on this core idea, rapid application integration and development rapid. And they argue that bringing AI into that mix, well, it just transforms its potential, especially in healthcare.
Exactly. You should think of Rapid as maybe a philosophy and a toolkit. It's all focused on speed, on agility. It uses things like low-code, even no-code platforms.
Right, those platforms people talk about.
And pre-built modules, automating repetitive tasks. The whole idea is just assemble and iterate on apps way faster than, old-school coding methods allow.
And the key insight here from what we read is how AI takes that speed and makes it smarter, more capable, especially with all the complexities in healthcare. They sort of describe AI as a powerful co-pilot throughout the whole build process.
That's a really good way to put it. It's not about replacing developers. It's augmenting them. Helping them move faster, yes, but also more intelligently.
What really stood out for me in the material were the specific examples, like how this AI-powered Rapid is actually being used in healthcare now. One area was clinical decision support authoring, CDS.
Oh, this is CDS, yeah, building those systems. It's known for being tough. Really tough. You need that deep clinical knowledge, right? But also the tech skills to translate it into logic software can actually run. It's often a real bottleneck for getting good evidence-based guidance to clinicians right when they need it.
So the AI helps kind of bypass some of that complexity. How does it actually streamline building those rules, those pathways?
Well, the sources suggest AI can help in a few ways. It might help translate clinical guidelines and, written in plain English into structured, executable rules. But maybe more interestingly, it could potentially analyze historical patient data, look at outcomes, and actually suggest improvements to rules, or spot where existing rules might be off or incomplete. Yeah, it's like having this assistant that understands both the clinical goal and the data patterns, which would lead to, more accurate recommendations.
Yeah.
And systems clinicians might actually trust and use more.
That ability to constantly learn and suggest improvements based on real data, that sounds incredibly powerful for keeping CDS current. And the impact. What did the sources say about the numbers?
According to them, this approach can cut CDS development time by, well, a really remarkable 30 to 50%, which, translates directly into big cost savings. And that's just one piece of the puzzle.
Wow, having development time for something so critical, that's huge. Okay, where else is AI-powered Rapid showing these kinds of results?
Automated protocol digitization. That's another key one. Just think about all the paper protocols, clinical pathways, forms that are still floating around in healthcare systems. Manually turning those into digital, usable formats. It takes ages, and it's easy to make mistakes.
Right, so this just automates that whole conversion.
Pretty much, yeah. Using AI to understand and structure the information from paper or even static digital docs, it lets organizations basically instantly turn those static protocols into dynamic digital tools. This really speeds up the shift away from paper, saves massive amounts of time and money compared to typing it all in or coding each one from scratch.
That seems like such a basic, foundational step for going digital. What about impacting the patient experience more directly?
Okay, so that brings us to patient-facing app personalization. Patients now, they expect digital tools, right? And they want health tools tailored to them. A generic app just doesn't really work if you're managing a specific chronic condition or following a complicated treatment plan.
Totally. We all want that personal touch, things that understand our specific situation. How does AI help build these personalized apps faster then?
So by using AI to analyze patient data, like their medical history, lifestyle, maybe even how they interact with the app itself, these rapid platforms can help developers quickly build features that are highly personalized. Think custom educational content, or reminders timed just right for their schedule, or care plans that actually adapt based on symptoms they report. And when you make acts more relevant like that, patients tend to be more engaged. They're more likely to stick with their treatment plan, which hopefully leads to better health outcomes.
And I guess from the clinic side, these personalized apps could maybe automate some routine stuff, communication, tasks.
Precisely. Things like automated medication reminders, appointment confirmations, maybe simple check-ins, that can definitely take some load off the clinical staff, free them up for the more complex patient interactions. And with AI-powered Rapid, these tailored apps aren't just some far-off dream. They can actually be developed and rolled out much, much faster.
So improving care and making the whole system more efficient. Okay, let's talk about efficiency inside the hospital or clinic. Workflow optimization. That sounds incredibly complicated.
It is. Healthcare facilities are these incredibly complex environments. So many interconnected processes, patient flow, staff doing their tasks, managing resources, the supply chain. Just figuring out where the slowdowns or inefficiencies are hiding can feel, well, almost impossible sometimes.
Yeah, like try and find that one tiny kink in miles of garden hose that's messing up the water pressure.
Exactly that kind of thing. AI can sift through enormous amounts of operational data, appointment times, room turnover rates, staff schedules, how equipment is used. And it can spot these non-obvious patterns, these bottlenecks that a person might easily miss. It could highlight why a certain type of procedure always seems to run late or why one department always has backups. And that leads to real, tangible improvements. Better operational efficiency, boosting patient satisfaction because wait times go down, and finding significant cost savings by using resources better. You can think of it like a smart system that's constantly analyzing how things run and suggesting specific data-backed ways to improve the flow.
That's really powerful insight for managers trying to make things run more smoothly. Okay, and finally, something that seems super practical for clinicians who are always busy, on their feet, hands full maybe, voice interface implementation.
This is huge, yeah. Healthcare pros often need info or need to update records quickly, efficiently. Sometimes they're in sterile environments or their hands are literally busy. The sources even use that really vivid example of a surgeon needing information right in the middle of a procedure.
Right. Yeah, you can't exactly stop and type on a keyboard or tap a screen easily then.
Exactly. So AI-powered voice recognition, natural language processing, it allows for hands-free interaction with clinical systems. Doctors, nurses, they can access patient charts, order tests, order medications, dictate notes, just by speaking commands. And this isn't just, convenience. It improves efficiency, cuts down on manual data entry time. It reduces contamination risk by minimizing contact with surfaces. It lets clinicians keep their focus right on the patient, and it saves valuable time.
So looking across all these different areas, building smarter clinical tools, digitizing protocols, personalizing patient apps, optimizing how things run internally, enabling hands-free system use. The common thread seems to be significant savings in both time and cost, driven by this combination of speed and AI intelligence.
Absolutely. But, getting these benefits, it requires careful planning, careful navigation, especially when you try to implement these systems in diverse, complex environments. The sources actually spend a decent amount of time discussing this, using a country like India as an example, which has its own unique challenges, right? You have to adapt global best practices to the local situation.
Okay, so what kind of specific challenges pop up when you're trying to roll out this kind of speed-focused tech in a setting that's complex? Varied?
Well, one major point is figuring out the right use cases first, the ones that are going to be most relevant, most impactful for that specific healthcare system. So in a place like India, maybe that means prioritizing solutions that improve access to care in rural areas or underserved areas, or maybe focusing really hard on reducing costs within the system. That could be key. Then there's the critical issue of data security and the infrastructure needed. You absolutely have to ensure patient data is secure, compliant with local regulations, which often means carefully using things like cloud computing, but navigating those specific privacy rules.
Yeah, data privacy and security. Non-negotiable everywhere, but the actual rules can differ so much place to place.
Precisely. And it's not just the tech. You have to focus on the people, too. Training healthcare professionals, who are often already stretched really thin on how to actually use these new systems effectively, that's vital for adoption. And fostering real collaboration, getting the clinical teams, the IT developers, the AI experts, talking and working together, that's key to building tools that actually work in the real world. The sources also strongly suggested starting small. Pilot projects, test things, learn, refine, before you try a massive rollout.
So it's not just about having the cool AI or the fast, rapid tools. It's the strategy around how you introduce them, how you support them in a real environment. What about the underlying technical stuff, the design considerations?
Yeah, the sources hit on several crucial technical points for success. Whatever you build, it absolutely has to be scalable, ready to handle more users, more data as things grow.
Mhm.
Robust security needs to be baked in from the very beginning, not tacked on later. Strict adherence to all the relevant regulatory compliance, totally non-negotiable in healthcare. And really importantly, the interfaces have got to be user-friendly, easy to use, and accessible on different devices, maybe a hospital desktop, but also a mobile phone out in a remote clinic. Because if the tools aren't easy for people to use, they just won't get used, no matter how fast they were built.
It becomes really clear that this AI-powered rapid,
Yeah.
it really does have the potential to fundamentally change the speed, the agility with which healthcare organizations can create and deploy the digital tools they so desperately need.
It genuinely feels like a paradigm shift, doesn't it? By embracing this kind of approach, healthcare systems can maybe stop just reacting and become more proactive, adapting quickly, innovating continuously, and ultimately delivering care that's, well, more personalized for each patient, more efficient in how it's delivered, and more effective in its outcomes.
And while those challenges in implementation, especially in diverse places, they definitely need careful handling, the potential benefits you've outlined from these sources, they seem vast.
Indeed. And I think what really resonated strongly from the material, for me at least, is that the ultimate goal here isn't just, faster software development for its own sake. It's really about empowering healthcare professionals, giving them the right tools, build effectively, build quickly using this approach so they can spend less time fighting with the technology and more time focus on what they actually do best, taking care of patients.
That shift in focus, enabled by this kind of rapid, smart tool development, it really does open up some fascinating possibilities for the future of patient care, doesn't it? Makes you think,